Kevin Proctor from PNC. Today, everybody attending this forum and all the presenters are investing their time and energy to ensure that Northeastern Pennsylvania is such a great place to call home. PNC is proud to be part of it and to be the presenting sponsor today. It is my pleasure to introduce Troy Lynn Lewis. Troy Lynn Lewis, PharmD, BC ADM, is an assistant professor of pharmacy practice at Wilkes University Nesbitt School of Pharmacy. She joined the Department of Pharmacy Practice after completing pharmacy practice residency training in ambulatory care setting in Carolina's healthcare system, Northeast in Concord, North Carolina. Her clinical practice site is at the Wright Center for Pharmacy Care, Mid-Valley in German, Pennsylvania, where she practices as an ambulatory care pharmacist. Her professional and educational interests include diabetes management, in which she is board certified anticoagulation, heart failure, hypertension, and COPD asthma. Dr. Lewis's most current research initiatives are focused on integrating diversity, equity, and inclusion into pharmacy curricula, where she has presented statewide and nationally on these topics. She is on the University Council of Diversity, Inclusion, and Equity, and has helped to form the first Diversity, Equity, Inclusion, and Accessibility Task Force at her School of Pharmacy.
Hello, my name is Troy Lynn Lewis, and I'm an assistant professor of pharmacy practice at Wilkes University's Nesbitt School of Pharmacy. First, I would like to thank the Greater Wyoming Valley Chamber of Commerce for inviting me here today to speak at the 2022 Diversity, Equity, and Inclusion Forum. Today, the topic that we're going to be discussing and the title of my presentation is Implicit Bias in Healthcare. Before we get started, I wanted to explain that I'm going to be speaking on this topic while wearing 3 different hats. The first hat that I am wearing is a pharmacist. I am a pharmacist by trade. I am a trained ambulatory care pharmacist, and I am board certified in advanced diabetes management. So it is imperative that I am aware of my own implicit biases so that I can provide the most optimal and equitable healthcare to my patients. The second hat that I'm going to be wearing as I'm speaking to you today is an educator. I'm a faculty member and a preceptor for doctoral pharmacy students, so I'm very privileged and honored that I'm able to help shape our future healthcare providers. Unfortunately, the COVID-19 pandemic shined light on some health disparities within our country. Implicit biases in our healthcare providers can further worsen some of those health disparities. So that's why it's imperative that our future healthcare providers are also aware of their own implicit biases. And the third hat that I'm going to be wearing while speaking to you guys today is as a human. I am Troy Lynn Lewis. I'm a daughter, I'm a sister, I'm a niece, I'm a cousin, I'm a dog mama, and I am a friend. In my personal life, I reflect daily on my own implicit biases. So yes, I'm coming to you today being as humble as I possibly can to let you know that I am not perfect. And hopefully by the end of this presentation, you will be able to reflect on some of your own implicit biases as well. The last section of the presentation, we will discuss how community partnerships can help decrease some implicit biases in healthcare, and you may find a role for yourself during that second of the presentation. So without further ado, let's jump into some of the content today. So first, our learning objectives. By the end of this presentation, you should be able to 1, define implicit bias, 2, discuss the negative impacts of implicit bias in healthcare, 3, identify ways to address implicit bias, and 4, discuss considerations for action through community health partnerships. So first, let's define implicit bias. This is going to be our buzzword for today. So exactly what does implicit bias mean? So by definition, implicit bias is the subconscious attitudes or stereotypes that affect our understanding, our actions, and decisions in an unconscious manner. Our implicit biases are activated involuntarily and without an individual's awareness or intentional control. So I like to say, this is what we don't think, we think. And it's important to note that our implicit biases can be things that are favorable and unfavorable. But regardless, they cannot be accessed without deep self-reflection and introspection. We all have implicit biases, and that's part of normal human cognition. Another thing that's crazy to note is that our implicit biases can run contrary to our conscious beliefs. And I'll say that one more time. Our implicit biases can run contrary to our conscious beliefs. So you may be wondering, what does she mean by that? So let me give you an example, and I'll use myself as an example. As a pharmacist, I can be deeply committed to providing my patients with the most equitable health care. I could be consciously and deeply committed to recommending medications that are the most safe and efficacious for my patients. However, I can have some subconscious or unconscious views and biases that may change how I practice that I may not be aware of. So, for example, I can recommend maybe more pain medication to a female patient versus a male patient because I have this subconscious belief that males are stronger than females. So, although I am deeply committed to providing equitable health care, I may be unintentionally harming my patients due to these subconscious beliefs. One thing I like to do when defining implicit bias is to contrast it to explicit bias, and this may be a definition that you're aware of. Let's look at the picture that I have on the screen here. We see an iceberg floating in water. We'll use the surface of the water to be an analogy of our line of consciousness. Above the surface, or above our line of consciousness, we have explicit bias. So these are our attitudes and beliefs that we have about a person or a group on a conscious level. We are fully aware of these so they can be self-reported. Our explicit biases are expressed directly and voluntarily acted upon. Now, below that line of consciousness, below the surface, we have those implicit biases, which we are talking about today. These are the unconscious attitudes that lie below the surface. And one big thing is that they may influence our behaviors. And that's something that we're going to be talking about on the future slides when we talk about how our implicit biases may influence the behaviors of our healthcare providers, which can in return cause negative consequences to our patients and patient outcomes. So our implicit biases are expressed indirectly and involuntarily acted upon. To further drive home these definitions, let's use an example to contrast explicit bias with implicit bias. So let's use an example and let's use an explicitly biased landlord versus an implicitly biased landlord. So our explicitly biased landlord is trying to rent out an apartment to tenants. Our explicitly biased landlord is going to discriminate in a conscious way and a direct way. So our explicitly biased landlord can stick a sign in the front lawn of the vacant apartment they're trying to rent and state for rent only for X type of tenants. So they can specifically focus on a specific type of racial group and discriminate against other racial groups explicitly, directly, and consciously. Our implicitly biased landlord, on the other hand, may have some subconscious or prejudiced beliefs about certain racial groups. And our implicitly biased landlord may not understand or know or be aware of those things. So when our implicitly biased landlord is looking to rent out their apartments, they may exclude patients by doing 5 additional background checks on specific racial groups because they may feel subconsciously that some racial groups are maybe lazy or dangerous, and they're not aware of these biases that they have. Both of these examples that I gave are unjust. And you may sit back and ask, okay, so why are we just focusing on implicit bias and not focusing on explicit bias today? When it comes to explicit bias, it's important to remember that these actions are regulated consciously. They're deliberately controlled and they can be self-reported. So we would hope that one can be aware of these explicit biases and try to decrease them as much as possible. Also, we have some laws and policies in place that can decrease some, but not all, explicit biases that we may see in society. So, for example, the abolishment of Jim Crow laws or the adoption of Fair Housing Acts can help eliminate some of our explicit biases. But it's important to note that some individuals may be explicitly biased and may have some conscious discrimination. However, they may do it in a discreet way. The point that I'm trying to make is that our individuals who are implicitly biased, they are not consciously aware of these things. So it's important that our individuals who are implicitly biased really make a dedication to be aware, to self-reflect, to kind of rewire and rethink the way in which they view a group of people or an individual. Addressing our implicit biases take patience, awareness, time, humility, and deep self-reflection. Our implicit biases can affect us in our daily interactions. They can affect the way in which we interact with our family, our friends, our coworkers, the things that we share on social media, the jokes that we find funny, And the thing that is most important to note is that they can affect our behavior and influence our behavior. And that's going to segue us into the next part of our presentation, which is implicit bias in healthcare. Unfortunately, some of these implicit biases can be present within our healthcare workers and can, in return, have negative consequences if our healthcare providers act on these implicit biases subconsciously. So, the first thing we're going to talk about when it comes to implicit bias in healthcare is the oath. So, you may know that all physicians take a Hippocratic oath, and we may know the saying that is, first, do no harm. A majority of the oaths that our healthcare providers take, the main message is to abstain from any ill intent, any malicious or intentional ill intent. So, for example, the oath of a physician I have listed here, I will come for the benefit of the sick, remaining free of all intentional injustice, from a classical version, and a more modern version of the oath states, responsibility must be faced with great humbleness and awareness of my own frailty. The Florence Nightingale Pledge for our nurses, I will not do anything evil or malicious, and I will not knowingly give any harmful drug or assist in malpractice. And finally, the pharmacist's oath states things such as, I will consider the welfare of humanity and relief of suffering my primary concern. I will promote inclusion, embrace diversity, and advocate for justice to advance health equity. And finally, I will respect and protect all personal and health information entrusted within me. So you can see a common theme that are in these oaths. A majority of research that is done on healthcare providers and implicit bias state that our healthcare providers do not have any intention to cause malice or harm to their patients, although it does happen subconsciously. And as I mentioned in the beginning of our presentation, our implicit biases can run contrary to our conscious beliefs and our conscious statements. So I could be directly committed to this oath. However, my unconscious thoughts can cause me to unfortunately and unintentionally cause harm to my patients. So here on this screen, we're looking at different types of biases that we can see in healthcare. So we have sexual identity bias, sex and gender bias, education bias, socioeconomic status, ableism or discrimination in favor of able-bodied patients, ageism or age bias, overweight and obesity bias, racial bias, and geographic location. I wanted to share a story. As I mentioned in the beginning, that I am not perfect and I work and focus on my own implicit biases day in and day out, especially being an educator, a pharmacist, being the individual who I am today. And one story I wanted to reflect on was regarding one of my patients at clinic. So this patient was getting a continuous glucose monitor. So this is a device that my patient would wear to continuously track her blood glucoses throughout the day and would eliminate the need for multiple finger sticks throughout the day. So my patient comes into clinic and brings all of her products with her that she got in the mail, and my job for the next 30 to 45 minutes is to make sure that she's confident, competent, and comfortable in that new device so that she can use it throughout the day. So this patient just turned 90 and she had her 90th birthday. So we're going through all of the different devices. I'm wrapping up the visit and I ask her, all right, what questions do you have? And at that moment, she reaches into her purse, pulls out her iPhone 13, and states, Troy, I just wanted to verify. I was under the impression I was able to use my iPhone instead of one of the devices that came into the mail. And she was right. She could use her iPhone. But I failed to even ask her if she had an iPhone. I assumed, based on my own preconceived notions of aging patients, that she wasn't technologically savvy. That's for my younger patients, not this elderly patient that I have here. I failed to provide her individual care for the individual that she was. Without her asking me that, I would have lost the opportunity to convenience her care. She carries her iPhone, her smartphone around with her all day long. It'd be very easy for her to utilize that device to check her blood glucose over using the device that came in the mail. So by me, with my subconscious thoughts and my beliefs, I grouped her into all aging patients, stating that, oh, she's not technologically savvy, when indeed she was. On the next couple of slides, I'm going to share some statistics regarding some of the biases that I have here on the screen. Some of these statistics that you'll see are eye-opening, to say the least, but they kind of put how serious and how severe these biases in healthcare can be. So first, we'll look at race. So based on a research study examining 500 medical students and residents, they completed a study where they looked at false belief statements and asked the medical students and residents if they believed in these statements or not. So some of these statements, for example, would be things such as Black patients have less sensitive nerve endings than white patients, or Black patients have stronger bones than white patients. These statements are not based on scientific facts, but they were surveying the students to see if they did indeed believe them. And half of the trainees, 50% of them surveyed, held one or more false beliefs, and 40% of first and second year medical students endorsed the belief that Black patients' skin is thicker than that of a white patient's skin. So you can see how having this false belief or this implicit bias regarding Black patients can maybe influence the behavior in which and the medications in which our physicians may prescribe medication to our patients. And another thing to put this in perspective, these false belief statements aren't 19th century relics. This study comes from 2016, so just merely 6 years ago. The next example we have is sex and gender. Based on a literature review of 77 articles, some medical professionals were more likely to dismiss chronic pain in women than in men and were more likely to view women with chronic pain as emotional, hysterical, and sensitive. And on the contrary, some medical professionals were more likely to view men as strong and stoic when dealing with pain. Sexual identity. Based on a systematic review of 600 plus research articles addressing bias among medical, nursing, and dental students, over 80% of students exhibited more negative evaluations of lesbian and gay patients compared to heterosexual patients. And finally, the last example that we'll talk about today is disability. Based on a secondary analysis of over 25,000 healthcare providers, 84% of healthcare professionals included in the study implicitly preferred people without disabilities. It's important to note that these implicit biases that we're speaking of, they can happen on the interdisciplinary level, the interpersonal level. So this is the level between the patient and the provider. It can hinder that dynamic between that patient and provider relationship. These implicit biases can also occur at the interdisciplinary level. By interdisciplinary, we mean multiple disciplines working together on a team for the benefit of the patient. So for example, we can have multiple disciplines such as a nurse, a physician, a pharmacist, a medical assistant, physical therapy, pulmonary, all working on one team for a patient. However, if one healthcare provider has an implicit bias of another healthcare provider, they may be less inclined to actively listen to their recommendations, and we may not get the most optimal recommendation out to the patient. And also, if there are some implicit biases amongst the team, this can hinder things such as leadership or promotional opportunities within that team, overall leading to less patient outcomes. And finally, looking at a 30-foot view, these implicit biases can occur on the institutional level. So now that we talked about implicit bias in healthcare, you may be wondering, well, how does this pan out? What are the consequences of implicit bias in healthcare now that we've reviewed all the statistics and the different types and examples? So as we mentioned, implicit bias in healthcare can lead to a decrease in patient outcomes and a decrease in healthcare team dynamics that we talked about on the previous slide. And that decrease can further lead to a decrease in patient health outcomes. A decrease in our patient health outcomes can be viewed as both a decrease in our patient's emotional and mental health, as well as a decrease in our patient's physical health. So examples of a decrease in emotion and mental health can be our patients can feel shamed, judged, silenced, inadequate, weak, or misunderstood. Think about the example we gave previously regarding gender bias. A male patient who may be in pain may be less inclined to go to his physician and ask for pain medications because he may feel weak due to the implicit biases that the healthcare provider has. Or a transgender patient may be reluctant to receive care or is more likely to avoid visits because they feel implicitly biased and judged before they're even able to adequately explain their healthcare and their situation to the provider that they're seeing. And a decrease in patient and physical health can be things such as misdiagnoses, improper diagnoses, mistreatment, delays in care, such as a delay in tests that are being ordered, a delay in labs, an overall decrease in the quality of care in which our patients receive. And in the end, this all leads to more medical cost and medical waste. So now let's switch gears and talk about addressing implicit bias. So we're going to be discussing some potential solutions and ways that we can address and mitigate implicit bias. But before we move on, I wanted to emphasize that word implicit and implicit bias. It is hard to measure, it is hard to fix, it is hard to be aware of. So, as I mentioned earlier, addressing our implicit bias is something that takes commitment and deep self reflection and introspect to be aware, to be humble, and to be dedicated to try to decrease your own implicit biases. I wanted to remind us of this oath that our healthcare providers take regardless of their profession. As we mentioned, our implicit biases can run contrary to our conscious beliefs. So we can be committed to these oaths that are on the screen. However, we may not, our behavior may be influenced by some implicit biases that we are not aware of. But regardless if we have implicit biases as healthcare providers, and as I mentioned, we all do, this oath holds us accountable. It is our responsibility to deepen our own awareness of our own implicit biases and try to mitigate them as much as possible. So, even if they do exist, it is our responsibility to try to decrease them. So, on the screen, I'm showing a framework that comes from the American Academy of Family Physicians. Although it is created by the American Academy of Family Physicians, it can be employed by both healthcare providers and non healthcare providers. This framework offers 8 different steps, which goes through the acronym for each letter of the word implicit, and talks about different actions or steps individuals can take to decrease their implicit bias. So, I stands for introspection. Explore and identify your own implicit biases through self reflection. So, some examples include journaling and talking to peers. M, mindfulness. Practice ways to reduce stress and increase mindfulness, such as meditation, yoga, or focused breathing. P, perspective taking. Consider experiences from the point of view of the person being stereotyped. So, some examples include consuming media about those experiences, such as books or videos, or watching documentaries. Or you can actually directly interact with people from that group. And if you are to do so, I recommend being an active listener, seeking to understand, expressing empathy and humility in those conversations. L, learn to slow down. Pause and reflect on your potential biases before interacting with people of certain groups to reduce reflexive reactions. This can include thinking about positive examples of that stereotype group. I, individuation. Evaluate people based on their personal characteristics rather than those affiliated with their group. And this is what I failed to do in that example I provided for the patient I cared for with the continuous glucose monitor. I failed to treat her as an individual initially. Instead, I was treating her based on the subconscious beliefs I had regarding aging patients. C, check your messaging. Embrace evidence based statements that reduce implicit bias, such as welcoming and embracing multiculturalism. It is your responsibility to educate yourself. So I strongly recommend that the resources that you are getting your information from are reputable and trusted resources. I, institutionalize fairness. Promote procedural change at the organizational level at your workplace that moves towards equity. So, examples could be reviewing policies and procedures, maybe taking a closer look at recruitment or hiring processes, or the steps in promotion and leadership within your organization. And finally, the last one and my favorite is to take 2. Practice cultural humility, a lifelong process of critical self reflection to readdress the power imbalances within everyday relationships. Remember, it is your responsibility and nobody else's responsibility to deepen your own awareness of your own implicit biases. And the last section that we're going to discuss today is community partnerships. So, how can community partnerships be a key to decreasing some implicit biases or the consequences of implicit biases that happen in healthcare to overall help our patients and patient outcomes? So, here on the screen, I have different examples of community partners that we have in our community. Examples include community centers and spaces such as our local YMCA, CYC, barbershops and salons, faith centers or groups, local TV or radio stations, or even national organizations such as the NAACP and local chapters within an area. So, individuals within a community come to these community centers and they feel a sense of belonging. They feel trust with the individuals at these community centers. So, we can utilize these community centers to bridge the gap and help collaborate with healthcare providers to decrease any potential consequences patients may feel when it comes to potential implicit biases. We can help instill trust and empower our patients. So I have stated healthcare providers can network with community partners as trusted voices within the community. These partnerships can empower and increase trust within patients who may have been subject to implicit bias. So remember on the previous slides, we talked about how patients may be reluctant to receive care, or they may feel judged or ashamed or silenced. But hopefully, with these partnerships and networking with trusted individuals within the community, with our healthcare systems, we can help mitigate or decrease some of those negative consequences. And on the other hand, this could also be beneficial to our healthcare providers. On the previous framework, that implicit framework we looked at, one of the recommendations was to increase direct interaction with individuals of other groups. So, by these partnerships, we can increase opportunities for direct healthcare provider contact with individuals from different groups. So, some examples of partnering that I can give is maybe having a local healthcare provider or local healthcare organization holding a blood pressure screening at a local YMCA, or going to a local barbershop and talking about the importance of medication adherence and handing out adherence aids such as pill boxes. One example that my students and I did a few years ago is we partnered with the NAACP, and we discussed in a public forum, a live Q&A, frequently asked questions regarding the COVID-19 vaccine. So we had individuals of our community that were hesitant regarding the vaccine. They were partnered with the NAACP, an organization in which they trust and felt empowered and that they belong to. I networked with the NAACP as a healthcare provider and as an educator within our community, and we were able to answer some questions to hopefully increase patients' confidence in the COVID-19 vaccine. So, looking at this list, you may find yourself part of some of these community partners and may be able to facilitate some networking and some partnerships with local healthcare organizations. So, this concludes my presentation. But before we wrap up, I wanted to leave you all with one quote. And this quote is by Maya Angelou that states, "We are only as blind as we want to be." So, once again, reminding you that you and only you are responsible to deepen your own awareness of your own implicit biases. Thank you so much. I am Troylyn Lewis. Here's my contact information and my references. Thank you guys so much and have a great day.